Well, in old days, and I've been at this for a long time, many years ago, I found that support groups had more negativity than positivity. They were made up of individuals who had bad outcomes from their treatments or bad experiences, whether it had to do with a functional result or their experience with their physician or nurse or whatever. And those are the people who really needed help. And the individuals who sailed through their treatments were really the silent majority. I'm really happy that that has changed and that now the people who've had positive outcomes are coming to the meetings and helping others as well. Because I had a lot of experiences in the older days where people would go to support groups and be scared silly because of it was a biased approach that they were hearing and they were seeing. So everybody has to know that there's positives and negatives. But fortunately, with modern treatments, the positives outweigh the negatives by a large majority. We hope that it would be nice if our results were 100% for everybody. That's clearly not going to happen. And we strive to provide the best of care to all of our patients. There's going to be bad things happen. You can't avoid that in medicine and in care. So I'm glad that the support groups are more balanced than they used to be. And going forward, will continue to be strong and sustained, and I will continue to send patients to the groups in their communities.
In terms of use of the internet for information on prostate cancer, I regret to say that I don't know if I regret this. Anyway, I don't use the internet to seek out access to information. If I want to find something specifically, yes, I'll do that. But I haven't found the need to do that.
Well, PSA has had a lot of press recently, and the controversy is almost exclusively around PSA screening. And one of the things that I often say to my patients who have prostate cancer, that the controversy is largely behind them. When you have an established diagnosis of prostate cancer, then PSA is a very useful tool. The rate of change of PSA with time after treatment, the level of treatment in a man on surveillance, for example, has really, it's tremendously important to what we do. And so I usually preface any discussion about PSA by dismissing the controversy that does exist with screening. Spouses often attend the support groups, but they're invisible there in the audience. It's very rare that they will ask a question. I think I've only ever once been asked a question by the spouse of a patient there. I suspect that they feel that the support group is for the men and that they shouldn't ask questions. But it's great that they turn up, although in relatively small numbers.
When a man is told he has cancer, that is the big boogeyman. Okay? You got to get rid of that boogeyman. You can't do that, I don't think, over the internet. It requires face-to-face, maybe hand-holding. It requires the human emotional touch. That can only come in a face-to-face contact. It can't happen over the internet. So again, there has to be a balance here. There has to be face-to-face, whether it's just with your individual care provider, with your family, with friends, or support group, whatever. There needs that human touch. We all need a human touch to be able to cope. Information can come over the internet, and that's a great way to disseminate information. So there's a role for the World Wide Web, but there's also a very strong role for the human touch.